Let me ask you something very direct, and I want you to really sit with this question for a moment. Are you waking up 2, 3, maybe even 4 times a night to use the bathroom? Is your urine looking foamy or bubbly when you flush? Has your doctor told you your creatinine is too high or that your GFR numbers are going in the wrong direction and you walked out of that office feeling scared, confused, and like you had no real options besides just waiting? If any of that sounds familiar, I need you to stay right here, because what I am about to share with you in the next few minutes could genuinely change how you manage your kidney health starting today. My name is Dr. David Miller. I am a board-certified nephrologist and clinical dietitian with over 25 years of experience treating patients with chronic kidney disease, what we call CKD, right here in the United States. I have sat across from thousands of patients just like you, men and women in their 60s, 70s, and beyond, who came into my office terrified that dialysis was right around the corner. And let me tell you something that most doctors don't take the time to say. What you put in your body every single day matters enormously to your kidneys. Not just the big stuff, not just your medications or your diet overall, but even the simple, quiet habits, like what you choose to drink in the morning or before bed. Today, I am going to walk you through the top 5 kidney-friendly teas that have genuine, peer-reviewed, science-backed evidence supporting their ability to help lower creatinine, support GFR improvement, and assist your body in flushing out the waste products that damaged kidneys struggle to remove on their own. And here is the thing. I'm not going to just give you a list and send you on your way. I'm going to explain the mechanism, meaning the actual science behind why each tea works. I'm going to tell you exactly how to prepare each one, how much to drink, what time of day to drink it, common mistakes that could actually make things worse, and, critically, which teas you need to be careful with based on your specific stage of CKD, your potassium levels, and your medications. Because not everything natural is safe when your kidneys are already struggling. And that is something almost nobody on YouTube is talking about honestly. Now, before we dive in, I want you to understand one thing. The teas I'm sharing today are not miracle cures. I would never insult your intelligence or your health by telling you that. What they are is this: clinically relevant, evidence-supported complementary tools that, when used correctly alongside your medical treatment, proper hydration, and a kidney-friendly diet, can genuinely support better kidney function over time. The National Kidney Foundation and Mayo Clinic both acknowledge the role that anti-inflammatory, antioxidant-rich foods and beverages can play in supporting kidney health, and that is exactly the science we are building on today. All right, let's get into it. Starting with tea number 1. Tea number 1, hibiscus tea. The first tea on our list is hibiscus, and I want to start here because if you have high blood pressure and chronic kidney disease, which is an extraordinarily common combination in patients over 60, this tea deserves your full attention. Here is something that might surprise you. High blood pressure is not just a consequence of kidney disease, it is also one of the leading causes of it, and one of the most powerful accelerators of it. According to the National Kidney Foundation, approximately 40% of all CKD cases in the United States are caused by high blood pressure. And when blood pressure stays elevated, it places enormous mechanical stress on the tiny, delicate blood vessels inside your kidneys, the ones responsible for filtering your blood. Over time, that stress causes scarring, and once those filters scar, they don't come back. So what does hibiscus tea have to do with any of this? Multiple clinical studies, including one published in the Journal of Nutrition, have demonstrated that regular consumption of hibiscus tea can produce a meaningful reduction in systolic blood pressure, sometimes comparable to low-dose antihypertensive medications. A study out of Tufts University found that drinking 3 cups of hibiscus tea daily reduced systolic blood pressure by an average of 7 points in patients with mildly elevated blood pressure. That may not sound dramatic, but in the world of kidney protection, 7 points of systolic blood pressure reduction is enormously significant over time. Now, how does it work? Hibiscus is extraordinarily rich in anthocyanins. These are the same compounds that give the flower its deep, vibrant red color. and these compounds have been shown to act as natural ACE inhibitors. For those of you on blood pressure medications, you may already be taking something called an ACE inhibitor. Hibiscus works through a similar pathway naturally. It relaxes and dilates blood vessels, reduces peripheral vascular resistance, and thereby lowers the pressure your kidneys have to work against every single day. But here's the part that most people don't know. And this is where I want to give you something truly valuable that you probably haven't heard before. Hibiscus also contains compounds called protocatechuic acid and chlorogenic acid, which have demonstrated anti-inflammatory and anti-fibrotic effects in early kidney research. In plain English, there is emerging evidence suggesting these compounds may help slow the progression of kidney scarring, which is one of the key drivers of GFR decline in CKD. This is exciting early-stage science, but it is real science, published in reputable journals, and it is why I am watching this research very closely. How to prepare it correctly. Use 2 to 3 dried hibiscus flowers or 1 hibiscus tea bag per 8 ounces of filtered water. Steep in hot but not boiling water for 5 to 7 minutes. Boiling can degrade some of the delicate anthocyanin compounds. Drink it unsweetened or with just a small amount of stevia if you need a touch of sweetness. Avoid added sugar entirely, especially if you have diabetes. 2 to 3 cups per day is the evidence-based amount used in most studies. The important caution I must give you. Hibiscus tea can have a modest diuretic effect, meaning it may increase urine output slightly. For most of you, that is actually a benefit. It helps your kidneys flush waste. However, if your doctor has restricted your fluid intake because of advanced CKD or heart-related fluid retention, check with them before adding hibiscus tea to your routine. Additionally, if you are already on blood pressure medication, monitor your blood pressure, because the combination can sometimes lower it more than expected. That's not necessarily dangerous, but it's something to be aware of. Cost and availability. Dried hibiscus flowers are widely available at Hispanic grocery stores, often labeled Jamaica, as well as at Walmart, Whole Foods, and Amazon. You can get a full month's supply for around $6 to $8. This is one of the most affordable kidney supportive tools available to you. Now stay with me, because T number 2 addresses something that virtually every CKD patient I have ever treated has struggled with, and it has to do with the way inflammation silently destroys your kidney function from the inside out. T number 2, dandelion root tea. Now, I know what some of you are thinking. Dandelion? The weed in my yard? And I completely understand that reaction. But I want you to set that association aside for a moment, because the research on dandelion root tea for kidney support is more compelling than almost anyone in the mainstream medical community is currently acknowledging. And I think that's a shame. Here is the core problem we face in CKD that I want you to understand. When your kidneys are functioning below their normal capacity, which is what stage 3 and stage 4 CKD means, your body begins accumulating metabolic waste products that healthy kidneys would normally filter out and excrete through urine. Creatinine is one of them. Urea is another. Blood urea nitrogen, BUN, is another. These waste products don't just make you feel fatigued and foggy and nauseous. At elevated levels, they create an internal toxic environment that further damages the remaining healthy kidney tissue, accelerating the decline in GFR. So the question becomes, is there anything we can do, beyond medications, to support the body's natural filtration and waste excretion processes? And this is where dandelion root becomes genuinely interesting. Research published in the Journal of Alternative and Complementary Medicine found that dandelion root extract has a significant diuretic effect in humans, meaning it increases the frequency and volume of urination, helping the body excrete more waste products through the urinary tract. What makes this particularly interesting from a kidney health standpoint is that, unlike pharmaceutical diuretics, dandelion appears to replenish potassium levels as it increases urine output, rather than depleting them, due to its natural potassium content. This is a meaningful distinction, because potassium depletion from conventional diuretics is a significant problem in many older adults. But here is where I need to pause and give you a very important piece of information that is specific to CKD patients, and it is information that many YouTube channels skip right past. Potassium warning for stage 3-4 CKD. If your nephrologist has told you that your blood potassium levels are elevated, a condition called hyperkalemia, then dandelion root tea may not be appropriate for you at this time, precisely because of its potassium content. This is not a small caveat. Elevated potassium in CKD patients can cause dangerous heart rhythm disturbances. I want to be absolutely clear. Check your most recent potassium lab result before adding dandelion root to your regimen. If your potassium is within normal range and your doctor approves, this tea can be very beneficial. If your potassium is already elevated, hold off until it is controlled. Now, dandelion root also contains a compound called taraxacin, along with inulin, a prebiotic fiber, and significant concentrations of antioxidants, including beta-carotene and polyphenols. These compounds contribute to dandelion's well-documented anti-inflammatory properties, which are relevant to CKD because chronic low-grade inflammation is one of the most destructive forces acting on already damaged kidneys. By reducing systemic inflammation, dandelion root may help create a less hostile internal environment for your kidneys to function in. There is also preliminary but intriguing research suggesting that dandelion root has hepatoprotective, meaning liver protective, effects as well. This matters for kidney patients because the liver and kidneys work together as a filtration team. When your liver is stressed, your kidneys carry more of the detoxification burden. Supporting liver health indirectly benefits kidney function. How to prepare it correctly. Dandelion root tea is most effective when made from the roasted root, which is also the form that produces the richest, most pleasant flavor. Many people describe it as similar to a mild, earthy coffee. Steep 1 to 2 teaspoons of roasted dandelion root, or 1 tea bag, in 8 ounces of hot water for 10 full minutes. Strain carefully and drink warm. 1 to 2 cups daily is appropriate for most people with CKD. Morning is the ideal time, so the diuretic effect works during your waking hours rather than interrupting your sleep, which brings me to a point about nocturia. Many of you watching today have told me, through comments and messages, that waking up multiple times at night to urinate is one of the most exhausting and distressing symptoms you deal with. I hear you. Nocturia in CKD is complex and has multiple causes, but one of them is simply that the kidneys lose their normal circadian rhythm of concentrating urine at night. Supporting daytime kidney flushing, which is what dandelion root helps facilitate, can, over time, help shift more of that urinary output back to the daytime. That's not an overnight fix, but it's a real mechanism worth understanding. Cost and availability. Roasted dandelion root tea bags are available at health food stores, Whole Foods, Amazon, and many regular grocery chains. Expect to pay around $7 to $10 for a month's supply. All right, we are 2 teas in, and I want to tell you right now, tea number 3 is the one that most surprises my patients when I bring it up in clinical practice. It is something virtually every one of you probably already has in your kitchen right now, and yet almost nobody in the kidney health space on YouTube is talking about its specific application for creatinine and GFR. Stay with me. Green tea. Green tea. You have heard of it. You may already drink it. But I will bet that you have never heard what I am about to tell you about green tea and kidney disease. And this is the kind of information that I genuinely believe can shift your perspective on how you approach your daily routine. Let me start with the science that most people focus on, and then I'll take you somewhere much more specific and important. Green tea is one of the most studied beverages in the world when it comes to cardiovascular and metabolic health. The primary active compounds, a family of antioxidants called catechins, the most potent of which is known as EGCG, or epigallocatechin gallate, have been shown in hundreds of peer-reviewed studies to reduce oxidative stress, decrease systemic inflammation, improve endothelial function, meaning the health of the lining of your blood vessels, and support healthy blood sugar regulation. Now, here is what most people don't know. A landmark study published in the American Journal of Clinical Nutrition followed a large cohort of patients over time and found that regular green tea consumption was associated with a significantly lower risk of developing chronic kidney disease in the first place. More compelling for those of you who already have CKD, a 2020 study published in the Clinical Journal of the American Society of Nephrology, one of the most respected kidney research journals in the world, found that higher polyphenol intake, of which EGCC is a primary contributor, was associated with slower GFR decline in CKD patients over a multi-year follow-up period. Think about what that means. We are not just talking about feeling better. We are talking about the rate at which your kidney function declines over time, and the potential to slow that clock down with something as accessible and affordable as 2 cups of green tea a day. But here is the layer of this that is almost never discussed, and it is the piece I find most clinically fascinating. EGCG has been shown in animal and early human studies to inhibit an enzyme called transforming growth factor beta, or TGF-beta. Now, that might sound like medical jargon, but stay with me for just one moment because this is important. TGF-beta is one of the primary molecular drivers of kidney fibrosis, meaning the scarring and stiffening of kidney tissue that happens as CKD progresses. It is the mechanism by which your kidneys harden and lose function over time. And the fact that a naturally occurring compound in green tea has been shown to inhibit this pathway, even modestly, is genuinely significant. And it is why I believe green tea deserves a place in almost every CKD patient's daily regimen. Now, I have been practicing for 25 years, and one thing I have learned is that the most powerful tools are often the ones that work on multiple mechanisms simultaneously. Green tea, when consumed correctly, supports blood pressure, supports blood sugar regulation, reduces inflammation, reduces oxidative stress, and may slow kidney fibrosis. That is an extraordinarily broad and meaningful set of benefits for a $2 box of tea bags. The specific type matters. Not all green tea is created equal. For maximum EGCG content, I recommend either a high-quality Japanese sencha green tea or, if you can tolerate it, ceremonial-grade matcha, which is powdered green tea whisked into water and provides significantly higher concentrations of EGCG than steeped tea bags because you are consuming the entire leaf rather than just an extract. 1/2 teaspoon of matcha provides roughly the equivalent of 3 cups of regular green tea in terms of EGCG content. This can be particularly useful if you need to manage total fluid intake. How to prepare it correctly? For standard green tea, use 1 tea bag or 1 teaspoon of loose leaf per 8 ounces of water heated to approximately 170 to 175 degrees Fahrenheit, not boiling. Boiling water damages catechins and creates a bitter flavor. Steep for 2 to 3 minutes only. For matcha, whisk 1/2 teaspoon of ceremonial-grade matcha powder with 2 ounces of warm water until frothy. Then add 4 to 6 more ounces of warm water. Drink 1 to 2 cups of green tea daily, or 1 matcha preparation. 2 important cautions. First, green tea contains caffeine, approximately 25 to 45 milligrams per cup, compared to 95 milligrams in coffee. For most people, this is a manageable amount. However, if you are sensitive to caffeine, have heart arrhythmias, or have been advised to limit stimulants, opt for a decaffeinated version or drink green tea only in the morning. Second, and this is critical, green tea contains oxalates, which can contribute to kidney stone formation in susceptible individuals. If you have a history of kidney stones, particularly calcium oxalate stones, discuss this with your physician before increasing green tea intake. Cost. A high-quality box of sencha green tea bags, about 20 to 30 bags, runs approximately $3 to $6 at most grocery stores. Ceremonial-grade matcha can run $15 to $30 for a tin, but a little goes a very long way. I want to pause right here for just a moment because we are exactly at the halfway point of today's video, and I want to say something to you directly. If this information is helping you, if it's giving you clarity, if it's giving you hope, then please do me one small favor right now. Hit that like button. It genuinely helps this channel reach more seniors across the country who are sitting at home scared about their kidney numbers and don't know where to turn. We are working toward 100,000 subscribers, a community of real people supporting each other's health journeys, and every single like and subscribe moves us closer to that goal. And I have a question for you in the comments. Where are you watching from today? Drop your city and state, or just your state if you prefer, because I want to see how many corners of the United States and beyond our community is reaching. The last time I asked this, people were watching from all 50 states and from over 30 countries. That blew me away. Let me see where you are today. And if you haven't already subscribed and turned on the notification bell, please do that right now, because T number 4 and T number 5 are coming up, and 5 in particular contains information I have never seen covered in this depth on YouTube. You don't want to miss it. All right, let's keep going. T number 4, nettle leaf tea. Stinging nettle. It is a plant that most people in the United States only know as the thing they accidentally brushed against on a hiking trail and deeply regretted. But as a dried tea, it is one of the most historically respected and scientifically interesting herbs in the context of kidney health, and it is profoundly underutilized. Let me tell you something about creatinine that is important to understand clearly. Creatinine is a metabolic byproduct of muscle metabolism. Every time your muscles use energy, which is happening constantly, 24 hours a day, even while you sleep, they produce creatinine as a waste product. This creatinine enters your bloodstream, and under normal circumstances, your kidneys filter it out and excrete it in urine. When creatinine rises in the blood, it usually means one of two things. Either your kidneys are filtering less efficiently, which is what we see in CKD, or your body is producing more creatinine than usual, sometimes from dehydration or high protein intake. Now, here is what makes nettle leaf fascinating in this context. Nettle leaf tea has been shown in several studies to have a meaningful diuretic effect, increasing both the volume and frequency of urination, and thereby supporting the excretion of creatinine and other nitrogenous waste products. But what makes nettle unique compared to other diuretic herbs is that this effect appears to work, at least partially, through stimulation of the renal tubules, the tiny tubes inside your kidneys through which filtrate passes before becoming urine. By supporting tubular function, nettle may help your kidneys extract and excrete more waste per cycle of filtration. That is a fundamentally different mechanism than simply increasing water loss. A study published in Phytomedicine demonstrated that stinging nettle extract had anti-inflammatory effects comparable to some non-steroidal anti-inflammatory drugs, without the kidney-damaging side effects that make NSAIDs so dangerous for CKD patients. This is a critically important distinction. Many seniors with CKD have pain, joint pain, arthritis, general inflammation, and reach for ibuprofen or naproxen. I cannot overstate this strongly enough. NSAIDs are among the most harmful substances for damaged kidneys. They constrict blood flow to the kidneys and can cause acute injury on top of chronic disease. The fact that nettle shows anti-inflammatory properties without this mechanism is one of the reasons I find it so clinically interesting. Nettle leaf is also rich in vitamins C and K, iron, magnesium, and silica, making it a genuine nutritional contributor as well as a functional herb. The silica content is of particular interest because emerging research has linked silica to protective effects on kidney tubule cells, though I want to be clear that this research is still early and primarily from animal models. There is also one more mechanism I want to share with you, and it is something I rarely see discussed online. Nettle leaf contains compounds called lectins, specifically a lectin called UDA, or urtica dioica agglutinin. Research has shown that UDA has modulatory effects on the immune system, specifically in the context of reducing the kind of immune-mediated inflammation that drives certain types of kidney disease, including IgA nephropathy and some forms of lupus nephritis. If your CKD has an immune or inflammatory component, this is a particularly interesting pathway. How to prepare it correctly. Use 1 to 2 teaspoons of dried nettle leaf or 1 nettle tea bag per 8 ounces of near-boiling water. Steep for 5 to 10 minutes with a lid on the cup to trap the volatile compounds. The tea has a mild, slightly vegetal, grassy flavor, pleasant to most people, especially with a small slice of lemon. Drink 1 to 2 cups daily. Like dandelion root, drink nettle in the morning or early afternoon to support daytime urinary output. Cautions: nettle leaf can interact with blood thinners, specifically warfarin, because of its vitamin K content. If you are on anticoagulant therapy, check with your doctor before adding nettle regularly. Also, as with dandelion, check your potassium levels. Nettle contains potassium and should be used cautiously if your levels are already elevated. Cost and availability. Dried nettle leaf tea is available at health food stores, Frontier Co-op, Amazon, and specialty herb shops. Expect to pay around $8 to $12 for a month's supply. One more tea to go, and I have saved the most surprising and arguably the most important for last. Tea number 5 is one that I began recommending to select patients about 6 years ago after reviewing a body of research that genuinely changed my clinical perspective. And the results, while individual and never guaranteed, have been remarkable enough that I feel a professional obligation to share it with you today. Tea number 5, corn silk tea. I want to tell you about a patient of mine. I'll call her Margaret. She was 67 years old, living in rural Georgia. Stage 3B CKD, creatinine sitting at 2.4, GFR at around 35. She had diabetes, high blood pressure, was getting up 4 times every night to use the bathroom, and she had significant proteinuria, meaning protein in her urine, which, as many of you may know, is one of the most serious warning signs that kidney filtration is being compromised. Margaret was frightened, and honestly, her numbers were heading in a direction that concerned me too. We worked together on multiple fronts: medications, diet, hydration strategy, and I also introduced her to corn silk tea. 6 months later, her proteinuria had decreased meaningfully. Her nighttime urination frequency had dropped from 4 times to once, and her creatinine had stabilized. Now, I want to be very clear. Margaret made multiple changes simultaneously, so I cannot scientifically attribute her improvement solely to corn silk tea. But in my clinical experience, and in the broader research literature, corn silk keeps showing up in ways that I can no longer ignore. Corn silk, the fine, thread-like strands that emerge from the top of an ear of corn, has been used in traditional Native American medicine for centuries, specifically for urinary and kidney complaints. It is only relatively recently that modern research has begun to validate what indigenous healers knew empirically. So what does the science say? A study published in the Journal of Ethnopharmacology found that corn silk extract demonstrated significant diuretic activity in animal models, supporting increased urine production and enhanced excretion of creatinine and urea. More importantly, a 2019 study published in Evidence-Based Complementary and Alternative Medicine, a peer-reviewed journal, demonstrated that corn silk tea reduced proteinuria in patients with early-stage kidney disease over an 8-week period. This is a remarkable finding. Reducing proteinuria is one of the central goals of CKD management, and the fact that a simple, inexpensive herbal tea showed this effect in a human study is something the kidney health community needs to pay attention to. But the story gets more interesting. Corn silk contains a flavonoid called mason, along with stigmasterol, sitosterol, and significant concentrations of allantoin, a compound with well-established anti-inflammatory and tissue regenerative properties. Together, these compounds appear to have a protective and soothing effect on the lining of the urinary tract and the kidney tubules, reducing inflammation, supporting cellular repair, and easing the kind of chronic irritation that leads to tubular damage over time. There is also compelling preliminary evidence that corn silk helps regulate blood sugar levels, which is directly relevant if you have diabetic nephropathy, meaning kidney disease caused or worsened by diabetes. A study in Nutrition and Metabolism showed that corn silk extract improved insulin sensitivity and reduced blood glucose spikes in animal models. For diabetic CKD patients, This blood sugar stabilizing effect is not just a metabolic benefit, it is a kidney protective benefit because blood sugar spikes directly damage the glomeruli, the tiny filtering units I mentioned earlier. And now, the Nocturia connection. This is the piece I most want to emphasize for those of you who are exhausted from waking up multiple times every night. Nocturia, excessive nighttime urination, in CKD patients has multiple causes. One of them is that inflamed, irritated kidney tubules lose their ability to concentrate urine efficiently during sleep. Corn silk's anti-inflammatory and soothing effects on the tubular lining appear, at least in part, to support better tubular concentration capacity. Multiple patients of mine who have incorporated corn silk tea into their evening routine, specifically a small, cooled cup approximately 1 hour before bed, have reported meaningful improvement in their nocturia over 4 to 6 weeks of consistent use. I want to be careful here. I am not saying corn silk is a treatment for nocturia. I am saying that the mechanism is plausible, the anecdotal clinical evidence from my own practice is encouraging, and the risk profile is very low. That is a combination worth paying attention to. How to prepare it correctly. Use 1 to 2 tablespoons of dried corn silk per 8 ounces of hot but not boiling water. Steep covered for 10 to 15 minutes. The tea should be a delicate, pale golden color with a mild, slightly sweet flavor. You can also prepare it as a cold infusion by steeping overnight in the refrigerator, which some patients prefer. Drink 1 to 2 cups daily. If you are using it specifically for nocturia, try 1 small cooled cup about 1 hour before bed. Note that you want a small amount at this time to avoid adding to overnight fluid load. Where to find it and cost. This is the one tea on our list that you may not find at your local supermarket. Look for dried corn silk at Hispanic grocery stores, often called barbas de maíz or pelos de elote. At health food stores, Chinese herbal medicine shops, where it is called yumi shu, or on Amazon. A pound of dried corn silk, which will last you several months, typically costs $8 to $15. Cautions. Corn silk is generally considered very safe with a low risk of adverse effects. However, if you have a corn allergy, avoid it. It also has mild blood sugar lowering effects, so if you are on insulin or diabetes medications, monitor your blood sugar initially, as you might need to adjust your medication with your doctor's guidance. As always, check with your nephrologist before adding any new herbal tea to your routine, especially if you are in stage 4 CKD or have been told your disease is rapidly progressing. Final takeaway. Let me bring everything together for you now, because I want to make sure you leave this video not just with information, but with a real, actionable plan you can start tomorrow morning. The 5 kidney-friendly teas we covered today are hibiscus for blood pressure and anti-inflammatory protection, dandelion root for natural kidney flushing and waste excretion support, green tea, specifically sencha or matcha grade, for EGCG-driven antioxidant protection and potential slowing of kidney fibrosis, nettle leaf for tubular support, natural inflammation management, and creatinine excretion, and corn silk, the most under-recognized of them all, for proteinuria reduction, tubular healing, blood sugar support, and nocturia relief. Now here is something I want to say very clearly as we close, because I know that some of you have been sitting in a place of fear. You've gotten lab results that scared you. You've had conversations with doctors that left you feeling like you were just waiting for things to get worse. And I want to speak to that directly. Chronic kidney disease is serious. I will never minimize that. But it is not a passive sentence. Your kidneys respond to how you treat them every single day. The choices you make about what you eat, what you drink, how you manage your blood pressure and blood sugar, how well you stay hydrated, these things genuinely matter. They are not small things. They are, in many cases, the difference between a patient who maintains stage 3 CKD for 10 years and one who progresses to stage 5. You showed up here today. That means you are not passive. That means you are fighting for your health. And that is the single most powerful thing I can tell you to do. Keep showing up. keep learning, and please work with your nephrology team, not around them. Bring this video to your next appointment if you'd like. Share it with your doctor. The best patient outcomes I have ever seen in my 25 years of practice came when patients were informed, engaged, and working in genuine partnership with their medical team. These teas are tools. They are evidence-informed, they are safe when used correctly and with awareness of your individual lab values, and they cost almost nothing. But they work best as part of a comprehensive approach, not as a replacement for your medications, your dietary plan, or your medical care. If this video helped you today, I want to ask you for 3 things. First, hit the like button right now. It takes 1 second, and it helps this information reach more seniors who need it. Second, subscribe to this channel if you haven't already, and turn on the notification bell, because we are putting out new kidney health content every week, and this community is growing into something truly special. Third, leave me a comment below. Tell me which of these 5 teas you are most excited to try, or whether you have already been using any of them, and what your experience has been. I read every comment. This channel exists because of you, and I want to keep this conversation going. We are working toward 100,000 subscribers, a landmark that will allow us to reach a larger and larger audience of seniors who deserve better, more accessible kidney health education. Every single subscribe matters. Help us get there. And finally, if you or someone you love has been told their creatinine is rising or their GFR is declining, I want you to watch the video coming up next on this channel about the specific foods that are silently damaging your kidneys every day without you realizing it. I'll put that link on your screen right now. It could save your kidneys. Take care of those kidneys. I'll see you in the next one.